Today in this class, I'll be discussing briefly about rehabilitation need assessment. So before moving on to the rehabilitation need assessment, I'll be telling about what is psychiatric rehabilitation, and then what are the tools that we use in psychiatric rehabilitation to assess the needs of patients, and then some of the studies that has been done in India, and then what are the important points that we need to keep while doing the rehabilitation need assessment. Yeah. So what is psychiatric rehabilitation? So the goal of psychiatric rehabilitation is to enable the individual to compensate for or eliminate the functional deficits, interpersonal barriers, and environmental barriers created by the disability, and to restore the ability for independent living, socialization, and effective life management. So what exactly is psychiatric rehabilitation? So as we all know that the patients with psychiatric disability will have some deficits after once they develop the illness. So what the psychiatric rehabilitation does is to help the individual to regain the skills that once they had, or to develop new skills to lead a independent life, to lead a life like others in the community. So that is what is meant by psychiatric rehabilitation. So let's see how the psychiatric rehabilitation has been emerged. So in 1960, there was deinstitutionalization movement where the psychiatric patients were discharged to the community without much preparation, and many of the community members and the family members were not ready to manage the patients, or they didn't know how to deal with the patient. So as a result of that, what happened was many patients become non-adherent to medication, and they become symptomatic. They again went back to the community. Again went back to the hospital, and then many of them became homelessness. So that is where that is the time where the psychiatric rehabilitation has been emerged. So as I told in the first slide, for those who are having psychiatric illness, they will have certain deficits in one or the other areas. Like for example, in activities of daily living, they will have difficulties in grooming or hygiene, maintaining a household, taking care of the children. And also in social functioning, like talking to the family members, interacting with them, interacting with the friends or community, or difficulty in workplace, and even they will have difficulty in concentration. They will not be able to be in the competitive like how they were doing it before, and the persistence. So those are some of the things that they lack once they have this once they develop the psychiatric disability. Next, let's move on to what are the components of psychiatric rehab assessment. So there are three components that is there in the rehab assessment. The first one is overall rehabilitation goal, and the second is functional assessment, and third is resource assessment. So let's see what is overall rehabilitation goal. So for example, like once the patient is ready for rehabilitation ready, then we fix a rehabilitation goal for the patient. So for example, the patient wants to be financially independent for say in a year or in 2 years. So that is what the overall rehabilitation goal is. So next we see what is functional assessment. So functional assessment means, for example, the patient wants to work, right? So what are the like strength, or what are the weakness that the patient has in order to achieve that goal, in order to work. So that is what we do in functional assessment. And then we do the resource assessment, where we see what are the resources that is available in the community where the patient lives. As I said, the patient wanted to work, right? So we have done the functional assessment. The patient might lack some skill, or we feel that the patient has to undergo some kind of skill training. So we need to see what are the resources that is available in the community where the patient lives. For example, there are a lot of skill training centers in the community by government as well as by NGOs. So we can explore more of that, and then we can help the patient achieve the overall rehabilitation goal. So this is the components of psychiatric rehab assessment. So moving on to need assessment. So we not only do the need assessment with the patient, we include the family members and we include the significant others and also the community members while doing the need assessment. It's not only, we don't stop it with the patient. So how do we do the need assessment? So we basically do interview. We use self-rated questionnaires. We speak to the significant others, and also we speak to different stakeholders while doing the need assessment. So let's see what are the tools that we use to understand the various rehabilitation needs of patients with psychiatric illness. So the first one is Camberwell Assessment of Needs. It's been developed by Social Psychiatry Unit of Medical Research Council in UK, and it's adapted to use in different population, and it's translated to various Indian languages, and it's a 22-item interviewer rated scale. And it also comes in two versions. One is for clinical purpose and one is for research purpose. So this is the scale that is the cancer scale, where some of the items are accommodation, food, looking after home, self-care, daytime activities, education, transport, money, benefits. But like when we actually try to do this in a very rural population, some of the items doesn't what to say, it doesn't it's not applicable in a rural setup. So we need to be very careful while applying or while choosing the scale. So the next comes WHO CBR indicators. WHO and the International Disability and Development Consortium has developed the indicator. It has 5 domains, where health, education, livelihood, social, and empowerment domains. So it captures the difference CBR makes in the lives of people with disability in the communities where it is implemented. So this is the CBR metric. So we usually do need assessment under these headings. So under health, we have promotion, prevention, medical care, rehabilitation, assistive devices. So we see what are the needs that they have under health. And under education, early childhood, primary, secondary and higher secondary, non-formal or lifelong learning. And under livelihood, we have skill development, self-employment, wage employment, financial services, social protection. And under social, we have personal assistant, relationship, marriage and family, culture and arts, recreation, leisure and sports, and justice. Under empowerment, we have advocacy and communication, community mobilization, political participation, self-help groups, and disabled people's organization. So under these headings also, we can do the need assessment for persons with severe mental illness. So this is what I have explained in that slide. So I'm just skipping. Okay. So the next comes rehabilitation need assessment schedule, which is developed at SCAR, Chennai. So it covers a total of 8 domains. So which include employment, vocational training, leisure activity, psychosocial attitude modification, skill training, and any help needed by family, and any other need not covered by above. So this is mainly a qualitative instrument where they ask question based on these domains. So the next is supplementary need assessment schedule, where this is developed at PGI Chandigarh, and it's needs from an Indian perspective, and it included domains relevant to like our population, such as free treatment, insurance, more time with the clinician, social support, travel concession, and so on. We not only use tools for assessing the rehabilitation needs, we also use the qualitative methods, like we use interview methods to assess the rehabilitation needs. So for that, we usually ask open-ended questions. For example, we like ask what housing needs do you have, or what education needs do you have, or what are the resources that they need to obtain the needs. And the main important thing in this qualitative interview is we need to be a very active listener, and we need to even paraphrase. Okay, this is what has been told by the patient, so we need to tell them, we need to paraphrase and tell them that, okay, this is what we have understood. So then only we will get a better idea about what is the need, as what's the need the patient is expressing. So these are some of the studies that has been done in India, and this is various tools used. So rehabilitation needs of persons with major mental illness in India. It's done by Dr. Ranjit R. Pillai. So the tools used are rehabilitation need assessment schedule. So where they have found that helping in finding employment, vocational training, modification of immediate family members' attitude, need for social skills training, those are the high priority needs that they have identified. And the next study was done in NIMHANS in close ward, in female close ward. So they have developed an interview schedule to understand the rehab needs. And these are the headings under which they have developed the schedule: accommodation, safety, diet, grooming, privacy, illness management, family, relationships, sexual recreation, education, occupation, vocational training, financial, emotional, spiritual, and any other needs. So the needs identified were more incentive, like food, variety of food they wanted in the close ward, recreation, grooming item they require, and wanting to be with the family, work, and education. So these are some of the needs, that high priority needs that they have expressed, expressed by female patients who are staying in close ward. So the next study, rehabilitation needs of persons with schizophrenia and their families. They have used rehabilitation need assessment schedule. So the needs identified were high needs in psychosocial modification, employment, help for family, and skill training by the patient. These are few studies that I have quoted. There are many more studies which they have, people have done it. So the advantage of using the various tools that I have discussed before is we will be able to quantify when it comes to research purpose. So, when we do more of qualitative interview, we tend to get more information of what exactly the patient needs are. And many of the tool what we have observed is it doesn't have many items. It's limited to very few items. For example, if I wanted to do with a woman with severe mental illness, for example, what about their prenatal or pregnancy related issues or needs? So those areas doesn't come under in any of the like tools that we have seen. So these are some of the advantages as well as disadvantages in this. Okay, moving on to the last point. So these are some of the important points that we need to remember before doing the rehabilitation need assessment. So rehabilitation need assessment is never a one-time process. So it's not like we go to a patient for the first session and we ask them, okay, what needs do you have? They are not going to open up in the first session, or we are not going to get exactly what they want. So that requires a trust-based relationship with the client, and we need to have good interpersonal skills. With the good interpersonal skills, we need to explore more with the sit and explore more on what the needs that they have, and we need to probe. then only they'll be able to come up with what are the needs that they have. And also, we don't stop with the patient. We need to have collaboration among the stakeholders also. We need to understand the family's perspective, even the treating team perspective, even community health workers or whoever is involved with the patient. We need to understand their perspective of patient's needs, and also arriving at a shared decision making with all stakeholders. For example, the case, like I'll give a case example which we see here in NIMHANS. So what happens is the patient will have a need. The patient have told that he wants to work in Swiggy. He has never worked in last 5 years. So he was symptomatic. He was at home. So, but he comes up and tells that he wants to work in Swiggy. That's what. So the patient have expressed the need that they wanted to. He wants to work in Swiggy with no previous work experience. He doesn't know how to ride a two-wheeler, or he doesn't have a driving license. But what the family feels that he has to have a daily routine, and what the treating team feels that he has to come to our daycare center to develop a daily routine, and then he can go for a skill training, and then he can search for a job. So three different aspects comes in. So we had to sit with the patient, we had to explain to him, and then I had to ask the patient actually to go back to to meet a Swiggy person who works in the company, and to ask him actually exactly what they do, what are the difficulties or challenges, what are the things that they require to get into the job. That is how we have reached a conclusion, and then we could make him come to the center so that he could develop a daily routine. So arriving at a shared decision is very important while doing a rehabilitation need assessment. And assessment of resources and opportunity in the community is an ongoing and dynamic process. So it's always a ongoing, and it's a changing process. It's never ends with one session or two sessions. So it's always a ongoing process. So these are some of the important points that we need to keep in before going for the rehabilitation need assessment. Yeah. These are some of the references. Thank you.